I would like to start by thanking Cecilia and the rest of the group for inviting me to this wonderful city. I will try to, to review a little bit the complexities when we look into the relation between nutrition and cognition and dementia. So I will take you a little bit from the more general to the more concrete, and it's a little bit, and maybe I will take you from big numbers to smaller numbers. Let me try to show to you some of the methodological challenges, but also some of the literature and where do we go from there. So this indicates that, there's an effort to, rather than asking people what they eat, to measure biomarkers in their blood. So, and here's an example on the left. You have different food groups, and then you have, different biomarkers that have been identified to, to measure, to estimate consumption of these food groups. There are about 50 of them. Here on the right side, there are these remaining things to do regarding these particular 50 biomarkers. A lot of issues, a lot of gaps in our understanding of these 50 biomarkers. So it's like every other biomarker, it's not a trivial thing. We have to have information about those responses. We have to have replication in different cohorts. We have to have, stability information and so forth. So all this work has recently started trying to estimate these biomarkers that reflect food intake, and it's really in the infancy. But so I showed you, more or less 50 food-related biomarkers, but the reality is that there are many more. This is the so-called the nutrition dark matter, and so let me see if I can. Okay, so you can see here there are about 140,000 chemical compounds that are estimated to exist in what we eat every day. These are color-coded based on, structural subclasses and chemical similarities. And just to give you an idea, on the right side, you can just see garlic. Imagine what proportion of our everyday diet is garlic. And just in garlic, there are about, 6,000 to 7,000 compounds, just in garlic. And you can see where they are in this nutrition dark matter. So it's quite more complex, and we have started, scratching the surface by trying to estimate, 50. And these compounds, they seem to be very biologically relevant. So what you see here are about, 18,000 human proteins. And that's what you see at the background in the gray color. And in pink color, you see which of these proteins are targeted by the food molecules that I showed you before. So almost half of the proteins we have in our body are targeted by these food proteins. So it seems that it's very biologically relevant and very pertinent. So the biomarker part of nutrition is still, in its infancy, but let's move a little bit to foods, right? So maybe we can move one level higher up in the pyramid. So the association between foods and cognitive change is not, it's not very well, it's quite conflicting. So this is a study we did a few years ago. We tried to take into account, big studies, more than 1,000 participants, prospective studies, and studies that included people who are cognitively healthy, and looking at changes, incidence of dementia or changes of cognitive function over time. So it's prevention data, it's not prognosis data, it's not people who already have dementia. And what you see in green are studies that suggest that there's a beneficial association for this particular nutrient or food group, and then in red, detrimental association, and then in yellow, neutral, so no association indicated. And as you can see, there's some data for, from flavonoids, for poly or monounsaturated fatty acids, for alcohol, for caffeine, for fish, for vegetables, but overall it's a very conflicting literature. And the truth of the matter is one could pick and choose a study and support an idea that has in his head, but if one looks at the whole universe, it's not clear about the beneficial or detrimental effects of different foods. But in reality, we do not eat nutrients. We don't eat vitamin A for breakfast and vitamin C for dinner, right? And we eat foods in combination. So one other approach in the nutrition science is to look at dietary patterns, combinations of foods. And there are many different dietary patterns. One could look into this article if, to compare one to the other. We have the Mediterranean type diet, and you can see from the nutrients and the food groups what identifies each of these dietary patterns. And actually, there are many more. There are many more. So one could look in a more holistic way into nutrition. So what about the literature on dietary patterns and cognition or dementia? The one that has most support for is the Mediterranean type diet. So one of these green dots is our study in Manhattan, another one in Greece, another one actually is the 3-city study here in France and in Bordeaux. And you can see that there is research for not only the Mediterranean diet, but for some other dietary patterns. I'm not sure it's enough, but there is some hint. But again, there are also conflicting results. So now I will go from the exposure part to the outcome part. So let's go into the cognition or the dementia part. So, cognition by itself is quite complex, although we use a word, but, it's, our language skills, it's our memory, and there are different types of memory, it's our visual spatial skills, it's our emotions, it's our judgment, right? So it's even in its phenotype, it's quite complex, but also it's quite complex in terms of the underlying neurobiological mechanisms. So we always have in mind amyloid, for example, on the top left, which is the main, neuropathology relating to Alzheimer's type dementia and tau, but there are so many other neuropathologies. So, there's alpha-synuclein, there's TDP-43, we have the so-called late, and there are vascular changes, there's inflammation, there's oxidative stress, and so forth. And if one looks actually at autopsy series, the most common underlying pathology of dementia is mixed dementia. So having isolated amyloidosis in the brain is about 20%, 25%. The most common is amyloid plus something else. And there are many different combinations of pathologies. So there's a lot of complexity in terms of the outcome part. So could nutrition affect some of these neuropathological pathways? So here's a study from New York a few years ago. I will just show you a couple of examples. 70, cognitively normal people followed for 3 years. So what they found in the study was that people who were following a diet that was more close to Mediterranean diet principles, a healthier diet, they had slower rates of amyloid accumulation over time in their brain. That's what you see with 0.6% per year with a red line, and then with a blue line were those who were following a less healthy diet, a diet that was further away from Mediterranean diet principles. And in collaboration with our colleagues in Australia, the ABLE study, we showed something similar. We replicated this finding. So what you see here, the tertiles are, number 3 are those who follow more Mediterranean type principles. And then you can see on the y-axis the rate of amyloid accumulation over the course of 3 years. So those that were following a healthier dietary pattern, they were accumulating less amyloid over time. So it seems that diet affects, brain amyloidosis, and there are actually, studies, touching into some of these other, neurobiopathological changes in the brain. Not that many, I would say. So this is one way to go to look at nutrition and look at a particular neuropathology, but it's not as simple. Because, one could imagine, let's say, a nutrient or a food affecting maybe in a positive way with green, let's say, a vascular mechanism, and then in a negative way, in red, maybe a neurodegenerative mechanism, and maybe not affecting some other mechanisms in blue. And then the effect on cognition would be like a linear combination, the weighted sum of the effects in these particular mechanisms. And then imagine what happens when we add the second nutrient, right? Which could have different effects on different pathways. So the truth is that it becomes very, very complex. And keep in mind, we're talking about one aspect of the exposome here, right? And so how can we better capture, estimate these effects of nutrition in these different mechanisms, pathways? So I will just show you a couple of examples. Of course, it's not a solution, just a very, very tiny attempt. So we have developed in Athens this study, it's called the Albion study. So it started in 2018. So we're focusing, like everybody, in the preclinical, in the prodromal stages. So we're trying to go early. And of course, we have an emphasis on lifestyle. And because we try to go early, we recruit from the age of 40, trying to go before the neuropathology in the brain has started. And we don't recruit people with dementia, but people who are cognitively normal, or at most they have mild cognitive problems. So before the phenotype of dementia develops. And right now we have about 450 participants. It's an open study. We keep on recruiting and we keep on following up. On average, we have 3.5 years of follow-up. These are the number of visits. We don't really have attrition, but it's just not enough participants have reached, the 6 or the 8 year mark. So what do we have in this study? Of course, as you can see, we have have information on nutrition and on cognitive function, but we try to use wearables, and we try to have an MRI, an electroencephalogram, and we try to use to have a lot of biomarkers. Beyond stool and beyond blood, we also try to get CSF. So we have CSF on everybody. And I think that's the most important asset of this study for now and for the future. And we are in the process of estimating many different, biological information, on stool, in blood. Of course, we have the genetics, and in CSF. Some of this is in progress. Some of this has been completed, not for everybody, but for the majority. So we have, for example, metabolomics in the blood, and we have proteomics in CSF. Untargeted proteomics, and we have started, looking into that. So one way to look into diet using this type of approach, actually I have to say that one of the limitations is what we heard yesterday. I mean, we have much more data than participants, which is a big challenge, but maybe in collaboration with other studies, we will be able to capitalize on this information. So one way would be to have some sort of molecular signature of different diets. So what you can see here, we started with the Mediterranean diet. The Mediterranean diet could be estimated using different scores. You can see the MDS, Mediterranean Diet Score, the MIND diet. So we can have different estimates, and sometimes the reason we have conflicting results in nutritional epidemiology is because of the way we estimate the exposure. So we wanted to see whether we could estimate a metabolite signature of a Mediterranean type diet and examine its association with cognitive performance. So we had a population-based study, the HELIAD, you see on the right, and we derived this metabolic pattern. And then in the Albion study that I showed you before, we replicated. So we created a pattern of about 30 metabolites that was capturing this essence of a Mediterranean type diet. And actually this pattern was mostly related to lipid pathways and inflammatory pathways and neurodegenerative pathways from the pathway analysis. And interestingly, we found that it was related to memory, both cross-sectionally and longitudinally. And it was performing better than the dietary scores that we were getting from the questionnaires. So it was capturing something more biologically relevant. So this is just an example. Of course, we're talking about nutrition and nutrients and foods and patterns, but there are other aspects of nutrition, other aspects of the exposome in general that haven't been touched yet. So one of these is what is called chrononutrition. So, there's almost no literature, very minimal literature on aspects like, does it play a role how many times I eat a day? Does it play a role on when do I eat? Does it play a role of when do I have my breakfast, or when do I have my dinner in relation to sleep, which is another very important factor? Does it play a role that I go to a conference in Bordeaux and then the regularity of my meals completely changes? the distribution within and across meal of all these nutrients. So all these things have not been looked at all. There are different aspects of nutrition and different aspects of the exposome. And part of the reason is that it has to do with the way we collect the information. For example, the food frequency questionnaires is the usual way to collect this information. So we ask people what they usually eat over the course of the last month, the last 6 months, the last year. So we do not have this temporal information. In order to do this, you need to have these dietary recalls. So that's what we have in Albion. So in each participant, we have 4 dietary interviews on 4 different days. So we ask them what do they eat on this particular day and when do they eat it. So we have this temporal dimension of the information. I will just show you a couple of examples very briefly. So this is a few years ago. This is people who are cognitively normal versus people who had mild problems at baseline. And if you look at their calories, they consume more or less the same calories. But if you look at the timing information, so let me guide you here. So what you have circled is 8 o'clock in the evening, 8 p.m., right? And on the right side, you see the global cognitive score. When you go from -3 z-scores to 0, you go from abnormal to normal. So people who are cognitively better, they consume most of their calories in the evening. And the opposite happens in the morning. You see here the caloric intake in the morning. So you see on the left, you go from 0 to -3 cognitive z-scores, and you can see, it's going up. So although we have groups of people that consume the same amount of calories, when do they consume the calories seems to relate to their cognitive performance. And without taking of your time, we had another study looking at how frequently we eat. So what we were finding there is that the more frequent eating and eating at later times was related to better cognitive performance. Very small study, very, very much in the beginning, but I just want to indicate you how much we still need to learn in this field. Another issue here is the issue of observational studies versus experimental approaches versus clinical trials. So I showed you before, this is the same slide I showed you before, the different nutrients and food groups and their relation with incident cognitive performance. And you see here the observational studies. Look at the trials. It's almost empty, right? And something not very dissimilar happens for dietary patterns. So these are the observational studies, and these are the trials. So the truth is that in terms of experimental manipulation in this field, we don't have very much. Some of the successful approaches actually are the so-called multi-domain interventions. I think Sandrine will talk to us a little bit more later in the afternoon. So I will just very briefly touch on this and show you, a few successful examples. There are other studies like the MAPT study here in France or the PREDIVA study in the Netherlands. But I will just show you just a few examples, and maybe Sandrine will expand a little bit more, because nutrition is one part of the exposome. So this is the very well-known, the finger study in Finland. You can see more or less 600 participants in the intervention and the control group. So the intervention here is nutrition, but not only nutrition, physical activity, control of vascular risk factors. These are the so-called multi-domain interventions. So it was a positive study. It showed, after 2 years, better cognitive performance in those people who were in the intervention versus the control group. But even a smaller study by the group of Christine Jaffe in California, the SMART study, you see the numbers. They also did a multi-domain intervention in cognitively normal people. Here is just to indicate that it was not only diet and not only vascular risk factors, not only physical activity, but also they targeted depression, they targeted sleep. And each participant was getting a different intervention depending on their needs. You see here the overlap of these different, detrimental conditions for cognitive health. And again, this was a positive study. It showed an effect after 2 years, despite the small sample size. A more recent one is the POINTER study in the US. And here we have 1,000 participants in a structured multi-domain intervention and 1,000 participants in a self-guided, which serves as a control group. And again, it's people who are cognitively normal, but they are at risk for cognitive changes. They have suboptimal diet and sedentary lifestyle, and some other risk factors for dementia. And there's a target of many different lifestyle aspects: physical activity, nutrition, vascular risk factors, cognitive stimulation, and so forth. And again, this was a positive study after 2 years. The effect sizes in all these studies are not that great, but still it's cognitively normal people. So it's quite impressive to see this efficacy with behavioral interventions. And the last study I will show it to you is this study from Australia. I really like this one because it was an online intervention that talks about feasibility and how we can scale up these interventions. And because it was online, there were advantages. So, for example, they were able to do it for 3 years. For 2 years was the intervention, and 3 years was a check whether there was, efficacy effects. And you can see they targeted different aspects of lifestyle, nutrition, but also physical activity, cognitive activity, and depression. And they had different modules depending on whether you were impaired or you had problems in one of these lifestyle factors or more of them. Here you see really big numbers, 3,000 participants in one group, 3,000 participants in the other, because it was online, so the cost was more manageable. They were really able to change the behavior through these online interventions. What you can see on the top left is the change in their nutrition, and then changes in their physical activity. So they were really able to change the exposure. And it was a positive study. There was also an effect in cognitive function overall and in different domains. So I will just end with some future directions. Maybe I hope I will use less time actually. So this is a paper by Cecilia a few years ago, talking about these issues. So clearly we go more towards personalized nutrition for dementia prevention, and nutrition not by itself, but within the whole exposome, taking into account, genetics, other lifestyle factors, but also different neurobiological mechanisms that may be happening in different people. This is a big issue. So the NIEHS convened this workshop where we tried to advise on how can we better, design interventional studies in this field. So it seemed from this working group. We came up with at least 2 approaches. Of course, they're not exclusive. One could think more of a personalized approach, so we could investigate with biomarkers, for example, what are the individual pathologies starting in people's brain, and we could target these pathologies using particular food groups or nutrients that have shown some effect, and then we could measure outcomes using biomarkers, so we could have small studies of shorter duration, but they can inform us much more about, effects on a neurobiological level and mechanisms. But at the same time, we could have these large, simple trials that we see in cardiology, for example, where we could have, thousands of people, and there the intervention has to be much simpler. It could be a pattern, or it could be a single nutrient, and then the outcome there could be even rougher. It could be even from electronic health records, for example. But then we could go to larger scale, and this could give us a lot of information on population health. So maybe we could use these 2 complementary approaches. And this is where actually the American Academy of Neurology is going. When we see people at our cognitive disorders clinic everywhere in the world, about a quarter or a third of these participants are people who are the so-called worried well. So people are really worried about their future cognitive health. So there's already a big demand for these preventive services. We do not need to create the demand. It's out there. And, the American Academy of Neurology has this Safest Brain initiative. And we have more and more development of the so-called brain health clinics in Europe and in the US. There's no clear, funding model for these clinics, but it's something that is in development. And there are also efforts for more clinical trials. You see the FINGER initiative from the Alzheimer's Association. So there are trials that have started happening in many different parts of the world, using, individual elements of the FINGER trial, customized on the geographies in the different countries. So there's a worldwide effort to have more and more interventional information from these multi-domain approaches. So finishing up, it seems we need more personalized models. We need to have a deeper dive into the biomarkers, both the nutrition biomarkers, but also the cognition biomarkers. But we need to take into account the whole exposome and have also a more holistic approach. So maybe nutrition along other aspects of lifestyle. Definitely we need more trials to have higher confidence, but there are a lot of challenges in terms of cost and duration, and definitely we need, and we all try to go earlier to the preclinical stages given this latency between brain pathology and cognitive changes. And I will stop here. Thank you.
Thank you. That was fantastic. I'm not sure I'm completely interpreting your data, but it sounds like we actually know quite a bit about good nutrition and what people should eat. And I think to me the missing piece is, all these diseases are getting worse. Obesity is getting worse, particularly in the United States. So what are the implementation barriers that are preventing this from, coming to the general public to improve their health? Because there's clearly a block somewhere. I don't know where it is, but there's something where the information doesn't get to the people, or the people won't take it up for some reason.
Yeah, this is I guess, we all know this is a whole science. How do you implement, and how do you change people's behavior? And it has to do with, there's a lot of literature from the psychological point of view, all these techniques, how do you make people convinced and what motivates people, but also there's all this literature on, environmental changes. When you go into a building, I don't know, you see the elevator or you see the stairs, and how do you walk, and how close are you in green spaces or into pollution space. So, I think, I'm not sure we need to have an absolute, answer whether something is fully, we're absolutely convinced that, certain aspects of nutrition definitely help for this particular disease, because we have also a lot of observational data. And I think I feel pretty confident saying to people that most likely, not definitely, if you eat healthier, it will help you on the long run. And if not in terms of dementia, we know it will help for, other conditions, like for diabetes, so it doesn't, it will be only a plus if you follow a healthier diet. Now, how do you convince them? I'm not sure I have a good answer for that, but it's all this effort from these different angles.
Yeah, great talk. So Americans seem to want simple messages around nutrition. And then you have people who deliver on this. There are some credible scientists that just say, remove fructose from your diet and you're going to be healthy. There are others that say it's the omega-6 fatty acids. That's why we're seeing such a massive increase in colorectal cancer. Others are, it's those artificial sweeteners. Get it out of the diet. So is there any credibility to these big offenders?
Yeah, I think one of the issues in nutrition science is that there have been a lot of changes over time, and that also has threatened the credibility. Once they asked Ansel Keys, he had changed his opinion about something, and they pointed that to him, and he said, when things change, I change, and you? So I think the same happens in science. We always, validate new things and we invalidate previous hypotheses. But what happens with nutrition, it's very much out in the news. So maybe there are studies in, I don't know, mesothelioma that have been proven to be wrong, but it's not in New York Times. In nutrition, everything that comes out, because it affects, it's in the interest of many people, it's out there. So the differences in what we learn and understand, get a lot of publicity. And regarding what people recommend, I think another aspect is that people, are focused in their small, narrow area of research. And what they find there, sometimes they want to generalize. And, that applies actually to me. I'm talking to you about nutrition, but it's not the only important factor, right? So if you're a basic scientist and you're doing research on omega-3s, and you think that, that's the whole world. But I don't have any particular recommendation for this. That's how it is, and the more we understand and we learn and we inform public, the better we can digest and filter the information that is coming from the media or from scientists.
Maybe a little bit more implementation science, so we better understand. Social media likes simple messages, and unfortunately, nutrition is not such a simple thing.
Exactly.
This is Eric Timmy from the Swiss Public Health Institute. Thank you very much for sharing your insights with us. I would like to briefly touch on the later part of your presentation, where you suggest that we should investigate the beneficial parts of precision or personalized prevention through nutrition, where you gave the example on Alzheimer's disease. I do agree that there's certainly some degree of variation of needs between individuals with regards of nutritional uptake. However, I'm not quite convinced yet why we should have specific diet recommendations to prevent specific health outcomes. So maybe you could briefly explain why you think that we need a specific diet to prevent Alzheimer's, or a specific one to prevent strokes or myocardial infarctions. For me, I have the notion that a good diet would prevent most of these chronic diseases.
Yeah, if you look at it, it's a good point. If you look at it from a public health point of view, you can go even before different types of dementia. You can go to different health outcomes, because then we will start saying what's a good diet to prevent diabetes, and what's a good diet to prevent cancer, and what's a good diet to prevent dementia, and then we have to pick and choose. But, from an individual point of view, we are not all susceptible to the same biologies. So we know that, if we do a PET scan, or now the blood test, the p-tau217, in people who are 50 or 60 or 70, certain people will have already accumulation of amyloid in their brain. And certain other people are more vascular patients, right? So, they have strokes, they have heart attacks, they have peripheral vascular disease. So it could be that, if I am prone to develop neurodegenerative changes in my brain, I could benefit more or less from certain aspects of nutrition or the exposome. And if I'm prone to develop a lot of strokes, a lot of vascular dementia, a lot of, blood vessel-related changes, I may benefit from different aspects. So, of course, it's very hard to give a very credible answer to that, but it's very conceivable, because these two are very, very different things. So that's the thinking behind that.
Thank you very much. That was very fascinating. I really like your future direction of taking a holistic approach in this. And I think especially you mentioned also nutrition or diet kind of relates to so many different aspects of life. For example, timing or regularity of sleep. And then also physical activity obviously also interacts with nutrition as well. So I wonder, do you know if there's any evidence sort of looking into the interaction of these different lifestyle factors and how that might influence cognition? Because I can see it can get really complicated in that. And also we recently found some evidence showing nutrition or diet actually impacts on your sleep. And then that can have downstream effects on cognition. So just curious to hear your thoughts.
Yeah, so very briefly, because I think we have taken much time between you and the coffee break. And all these lifestyle factors are correlated. They're certainly not collinear, but they're clearly correlated. interaction, it's a very big literature, very mixed literature. I'm not sure about, additive or multiplicative interaction between different lifestyles. I think we're very far, we're beyond this level. Now, regarding the question about sleep, there's a lot of research on sleep and its importance in relation to dementia, but studies looking both at nutrition and sleep are really very few. We have a lot of neurobiological information about the effect of time of nutrition on the quality of our sleep, but looking at these two parameters in relation to dementia, I think we don't have a lot of information yet. Thanks.